Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. Today we'll provide another COVID-19 update from the hospital perspective. So let's get started. This slide shows the number of COVID-19 patients in the hospital across all the hospitals in our region. The region is defined by the counties at the bottom of the slide. So if you follow the purple line, which is all patients in the hospital, you'll see that as of February 1st, that number was 699, and it is still rising. To put that in context, during the Delta surge over on the left-hand side of the graph, our absolute maximum was 757. Also, when I updated you a week ago, that number was 620. If you see the red line, which is intensive care, that line is very slowly rising, not nearly at the rate of all patients in the hospital. This slide shows our hospital. You see that today we have 171 COVID-19 patients in the hospital. Just a few days ago, that number was 180, which was equivalent to our prior all-time maximum that we had experienced during the Delta surge. This slide shows COVID-19 hospitalizations across the state, and I've changed this table a little bit from prior weeks. The first column shows the current census in the hospital. The next column shows the census last week, and then the third column shows the trend. So first of all, for the entire state, the state appeared to peak in the last 7 days at 3,314 and is down to 3,091, so there's a plateau. The Nashville region has plateaued. Memphis is clearly declining at this point, but you see that Knoxville is still rising. Last week, 510 patients in the hospital. This week, 622. And again, the numbers don't exactly line up to the prior slide just because the regions are defined a little bit differently here. So that was hospitalizations. Now let's look at cases. This is new cases in Knox County. And if you look at the right-hand side where the red circle is, you can see that the number of new cases per day really appears to be dropping over the last 7 days. Not every single day is lower than the day before, but overall, it seems to be lower than the prior peak. And so this is good news. This is shown even more clearly when we look at new cases per 100,000, and this is again in Knox County. If you see the green line, which is the trend in the last 14 days, and the red line, which is the trend in the last 7 days, both of those lines really appear to have peaked and maybe even starting to come down. So that's good news. So to summarize, our regional hospital census of COVID-19 patients is still rising. And at this particular moment, it's one of the fastest rates in the state because some of the other areas are plateaued or are dropping. Cases, though, appear to be dropping in terms of their rate of diagnosis. We know from before that hospital census trends always lag behind case trends, so this pattern is expected. Looking toward Memphis, once the Memphis region's hospitalizations peaked, the hospital census dropped by about 30% over 2 weeks. So we're hopeful that now that cases have peaked, that hospitalizations will plateau in the next 7 days, and we'll start to see a rate of decline similar to what Memphis seems to be experiencing. So I'd like to close with these thoughts. As I mentioned last week, when you combine the COVID-19 hospital census numbers I just described, then think about the number of healthcare staff that have been out sick due to COVID-19. Then you factor in the staffing challenges that were left over from the Delta surge, and then also just the cumulative fatigue that everyone is experiencing. This is a very challenging time. What I've shown you, though, is reason for optimism. Cases appear to have peaked and are starting to improve, and we do expect the hospital situation to improve in the coming days, but that's not going to happen overnight. So now more than ever, it's still a very important time to show those healthcare team members kindness and patience as they navigate through this. And a word to them, to our healthcare team members. Taking care of people is a noble profession. It's a calling. And that's always going to be true. So just a special thank you for hanging in there with us. So I'll now close today the way I always do, with our next steps for the community. And they haven't changed. But just remember that just because the cases are starting to drop doesn't mean the risk has gone away. So as always, mask wearing, vaccinations, boosters, and if you have symptoms, get a COVID test and stay home until you know the results. As always, we appreciate your time, and we'll be back with you next week for another update.